Do you know that the first line of treatment for high blood pressure hypertension is not drugs? And that you can actually have your blood pressure being well controlled without taking drugs. And for some people who might actually not have their blood pressure controlled without taking drugs, they will only need minimal amount of drugs. Now, if you are hypertensive, or you have someone that is hypertensive, or you want to prevent being hypertensive, this video is going to be super important for you, because we are going to consider what the WHO, the World Health Organization, refers to as lifestyle modification, and the International Society of Hypertension also recommend it as the first line of treatment for high blood pressure. And this is what we call lifestyle modification for the management of high blood pressure, which is what we want to be considering step by step hereafter. This video is going to be a 10-in-1 video, because we are going to consider the 10 points highlighted by the WHO and the International Society for Hypertension in managing blood pressure. Number 1, salt reduction. The commonest source of salt in our meal is actually the table salt. However, that's not the only source. In fact, in some countries, up to 80% of the salt we take, comes from fast food. So, in order for us to control the amount of salt we are taking, we have to reduce the amount of salt we add to our daily meal. Check the label of any ready-made or fast food you are buying, such that you'll be able to know how much salt is in that meal. Salt is so important that it has been shown recently that if we're able to reduce the amount of salt we take, generally, globally now, we'll be able to save 2.5 million lives from death by reducing the amount of salt we add to our meal to just 1 teaspoon per individual per day. However, it's not enough to also reduce the amount of sodium in our meal. We also want to increase the amount of potassium, and that is why potassium becomes an important component of our daily meal. So point number 1, salt reduction. The next thing we want to consider is taking healthy drinks. Moderate consumption of coffee, green tea, and black tea has also been shown to be very important. Also, as a very important component of our daily drinks, the beverages we take, we want to make sure the amount of sugar in it is significantly reduced. The third thing we want to consider is moderation of alcohol consumption. If you are an individual that takes alcohol, you have to moderate the amount of alcohol you take to a maximum of 2 standard drinks per day. A standard alcoholic drink contains 10 grams of alcohol. So for males, you should not consume more than 2 standard drinks, that means 20 grams of alcohol per day. And female, maximum of 1.5 grams per day. Note this, we are not saying that alcohol consumption is good for blood pressure control. No, we are talking about the fact that if you cannot do without taking alcohol, you need to minimize it in order to be able to have a good blood pressure control. Number 4, regular physical activity. This is a very, very important point, because we are in a generation where we are used to living the sedentary lifestyle. And for our regular physical activity, what is required of us is to spend at least 30 minutes every day doing moderate amount of 30 minutes daily. And what kind of exercise is recommended? It doesn't have to be a very vigorous exercise. 30 minutes stretch, 30 minutes jogging, cycling, or swimming. These are simple exercises that is enough. However, we need to do it regularly and make sure we do it for at least 5 to 7 days a week. The 5th point to be considered is reduce stress and induce mindfulness. Stressful lifestyle is associated with increased blood pressure in the long run. So we want to minimize the amount of stress we expose ourselves to, or find other alternative ways of managing stress. One of such ways is what is referred to as mindfulness, otherwise known as meditation. Number 6, healthy diet eating. A healthy diet for the purpose of proper blood pressure control will be that diet that includes high amounts of vegetables, a lot of fruits, whole grains, and polyunsaturated fats and dairy products. The U.S. National Institute for Health developed what is referred to as DASH diet, DASH, which means dietary approach to stop hypertension. Now, this is just a dietary plan whereby people can take a specific type of food in order to achieve good blood pressure control. And what are the components of the so-called DASH diet? They are actually diet that has lots of vegetables in it, has fruits, whole grains, and low. Now, it's important to note about diets that there are other important complements like the potassium we mentioned in the first point. So we need to take food that has high amounts of potassium as well, take food that has a lot of calcium, and at the same time high amounts of magnesium. Such a food can include things like avocado, seeds, and nuts. The next point we want to consider is weight reduction. Weight reduction. And the purpose of weight reduction in managing hypertension is to avoid or prevent obesity. And our interest specifically about obesity has to do with what we refer to as abdominal obesity. How do we assess this obesity? We use what we refer to as body mass index, BMI. Another way of assessing obesity is for an individual to use his waist to height ratio. If the ratio is less than 0.5, it is okay. So 0.5 is the cutoff or acceptable value for waist to height ratio. Note, waist to height ratio of less than 0.5 is acceptable for all population. Number 7, stop smoking. Smoking has been associated with high risk of cardiovascular diseases, high level of cancers, and at the same time, smokers usually have what we refer to as chronic obstructive pulmonary disease, COPD. Number 9. Complementary alternatives or traditional alternatives are not recommended, especially those products that doesn't have a proven efficacy and safety. Number 10. Might sound strange, but it's actually a very important factor to consider. Avoid unnecessary exposure to air pollution and reduce exposure to cold temperature for a long time. This has been shown to have a long-term effect in making people to have high blood pressure. Note this about this video. The details we have given just now is just for information purpose. It's not a replacement for the necessity to visit your doctor. Thank you. Thanks for watching the video to the end. Please click the red subscribe button below so that you can get notified each time we release a new video. And please do share this medical education video with your loved ones. Thank you.